Good afternoon and welcome everybody. My name is Anna Rowinska and I am your technical host today. Thank you for joining us as we mark the National Day of Mourning to talk about the impact of loss in the workplace. Our moderator today is Lisa McGuire, founder and CEO of the Manufacturing Safety Alliance of BC. Welcome, Lisa.
Thank you, Anna, and welcome all of you for joining us today. Every year on April 28th, workers, families, employers, and others come together to remember those who've lost their lives on the job and to renew our commitment to creating safer workplaces. Canada first recognized the Day of Mourning in 1984, made it a national observance in 1991. Today, countries around the world honor lost and injured workers on this day. Year over year, Canada loses thousands workers to preventable workplace fatalities. Another 300,000 workers are injured on the job. And the past year has been like no other in our memories. Research indicates that Canadians have experienced more than a year of declining mental health and increased mental stress, anxiety, and isolation. We feel each of these losses in our workplaces across every industry, including our own manufacturing and food processes sector, who have been on the front lines since this pandemic has began. Yet nowhere has the impact been more prevalent than in healthcare, where they are living the devastating losses every day. Before we meet Andrea McKinley, who would like to share a glimpse from global news into the physical and mental health impact of COVID-19 and the opioid crisis on frontline workers, into where we are with this crisis. A registered psychiatric nurse, Andrea McKinley, is a new addition to our health and safety team here at the Alliance and comes to us with a unique insight into the world we've seen many times over this pandemic in that short video. Welcome, Andrea, and thank you for joining us to share your experience with us from the front lines.
Hi, everyone. I'm Andrea McKinley, and I'm a registered psychiatric nurse. I've been nursing in mental health and addictions for 15 years. And I just wanted to start by acknowledging the people who've been injured or lost their lives on the job because of a work-related injury. I know that firsthand how difficult this can be because I've had a few injuries at work over the years myself. And I've also seen many of my colleagues injured as well, both physically and mentally. So safety in the workplace is so important. Just this last week, we lost our first nurse to COVID-19 after she contracted it in the hospital and later passed it on to her son and husband. She was one of over 1,200 nurses that became infected with the coronavirus in BC since the start of the pandemic. So our nurses are putting themselves and their families at risk because they have a professional and legal obligation to do so. This really speaks to the level of risk we work within every day and how important it is to create safer work environments for employees for both our physical and mental well-being. In the past year, the government has changed the Workers' Compensation Act to include a list of mental health disorders that are associated with high-risk, high-stress jobs like policing, firefighting, and nursing. And we know nurses alone are accounting for 12% of the claims that are being made today because of mental health disorders and due to high rates of emotional stress. So when I refer to the prevalence of workplace injuries, I'm not only talking about physical injuries that can sometimes come with nursing, like a needle stick injury or hurting your back, but I'm referring to mental health injuries like stress, anxiety, burnout, and post-traumatic stress disorder. These are injuries that are having huge implications on the quality of care that nurses are able to provide to their patients, but it's also having a huge impact on the way we as nurses feel about the work that we do and are able to, our ability to cope in these demanding work environments. I know that for myself, this past year has been one of the most challenging years of my career, mainly due to the impact of COVID-19 and the opioid crisis. It's added more pressure to an already stressful, intense work environment where we're dealing with a staffing shortage and nurses working long hours, sometimes 18 hours a day. We have a lack of resources, lack of PPE. So the work that we do becomes so much more demanding, both physically and mentally. We're seeing a rapid increase in the presentations to our hospitals and our emergency departments with patients who are struggling with their mental health And they're coming in with issues like anxiety and depression, loneliness, grief and loss after losing loved ones, lots of substance abuse because people are self-medicating with drugs and alcohol, and ultimately suicide, not only in adults, but with our youth as well. People are struggling to cope, and they're struggling in silence. And the effects of the pandemic have made this so much worse with the isolation and not being able to connect with their loved ones. So for a nurse who specializes in mental health, I know that we are doing more crisis intervention in the hospitals today than we've ever done before, which is really hard work mentally. And then you add that to the stress of whatever you might have going on in your personal life. So this is having compounding effects on our nurses, and many are feeling burnt out and ultimately leaving our profession. So just to give you some context in terms of how busy the area of mental health has become, back in 2009, I worked as a psychiatric consultant in the emergency department at Surrey alongside of another nurse. And so between the two of us, we sat in a tiny office next to triage, and we would conduct assessments with patients who came in with any type of mental health problem. And it was a service that was initially only offered during the day. And in a shift, we might assess maybe between 4 or 5 people between the two of us. But today, Surrey Memorial Hospital has its own dedicated psychiatric emergency department that has nurses, social workers, care aides. We have our own security team. We have a pediatric psychiatrist and a general psychiatrist. So this tells us that the prevalence of mental health is growing rapidly in our communities, and the acuity of our clientele is also increasing. We are operating at maximum capacity in our hospitals on most days, and there's a pressure to treat and discharge patients as quickly as possible, which is also very morally and ethically distressing for us, because we often discharge patients too soon to create capacity within our hospitals. The turnover rates are increasing, we're short-staffed. The level of violence that we encounter from patients on a daily basis is also increasing. So there's a lot of additional pressure from an already stressed healthcare system that's been put on our nurses today. In addition to your typical mental health issues, the pandemic has taken its toll on the general public. And we are seeing this as more and more people are presenting for reasons like job loss, financial hardship, domestic abuse, child abuse, addictions. And we are seeing the impacts of people who are grieving the losses of their loved ones from both COVID-19 and the opioid crisis. We're seeing more patients, more parents and families that are accessing our service from losing their children to fentanyl overdoses. And they're looking for access to support loved ones who are struggling with addictions. And this is devastating. If you've ever encountered a mother who's lost their child to drugs or an overdose, it's something that stays with you forever and you never forget it. And then you have the families that are struggling to cope with not being able to see their loved ones and who are living and also dying in long-term care facilities. So I know that for myself, I started to have a lot of anxiety at the beginning of the pandemic, and that's something that I've never had before. Everything was changing so quickly. We had so many new protocols to follow and to implement, and things were changing literally hourly. And there was a concern that we were going to contract the disease and possibly bring it home to our families. So operating daily with these fears is very taxing on your mental health. I have friends that were exposed to COVID-19 and had to live in their trailer for 2 weeks so that they could keep their family safe, which is awful when you have little children that don't understand what's happening. So for me, this quickly turned into a burnout situation that I didn't even recognize within myself. And that's because burnout often happens over time, where people start to feel disconnected from your team and your colleagues. Your workplace morale is low. You feel emotionally checked out from your work. And then you have the pressure to do more for your patients, but with fewer resources. So it's important that we talk about mental health and reducing the stigma that's associated with it, because every family is affected by some type of mental health issue. So we need to normalize this by having those difficult conversations and creating awareness. It's also important to learn about self-care and ways to support ourselves. This might be through family members or friends, or services in the workplace, or connecting with your family doctor or other healthcare professionals. If you're feeling sad or depressed, unmotivated, you're losing interest in your work or your activities that you previously enjoyed, irritability and isolation, and often losing sleep. These are all signs to watch for because they are some of the more common denominators in some of these illnesses. So again, I can't stress enough how vital it is to reach out for help if you notice something is not right within yourself. And at the end of this presentation, I've provided a list of resources for support in many of these areas that we discussed today. So I encourage everyone to have a look at those and see if there's something that might be helpful for you or a loved one. Do we have any questions?
Thank you, Andrea, for sharing this information. Once again, we will absolutely be able to link the free resources to this presentation to all of you who've joined us here today. And very much appreciate you, Andrea, for sharing your story and absolutely open it up for questions. Anyone have a question for Andrea that they'd like to ask? And very much appreciate you sharing your information with us today, Andrea. Andrea, what would you like to make sure people take away from your experience? So really looking at, what would you like to tell all of us?
Right. I think it's really important to just for people to reach out for support. If you're feeling any of those symptoms that I've described, or you're just really, having not a great day and it's been going on for longer than, what is normal for yourself, I think it's important to reach out for support. So talk to your friends, talk to somebody. And also for us to acknowledge that this might be happening with our coworkers and our friends, and to approach people that we think might be struggling. I think that people have the opportunity to talk to their doctor if you're looking for something that's more confidential and outside of your workplace. And you can ask for referrals to community mental health centers. Every city in the Lower Mainland has a community mental health center that offers assessments and treatment. They offer individual and group therapies, and they can refer out to other programs as well. So there's a lot of help out there.
Thank you, Andrea. And another question that has come in, and I appreciate the links to all of those valuable resources. Please take them away and share them as well. Can you provide some examples of self-care we can do when we're at home, and especially many of us isolated when we're at home?
Yes, I think it's important to reach out to people, and using technology today seems to be the way that everyone seems to connect. So if you have the opportunity to do that, I know it's hard for us to connect with our friends and we can't be together, but reaching out on the phone, doing those Zoom calls, FaceTiming, just having the conversations is the best way to do that.
Another question, and one that we get most often, are really looking at some of those signs that maybe some of our colleagues are experiencing. What are some of the signs of mental health concerns we might notice in a colleague or a friend, and how do you approach them respectfully?
Right. Well, I think that, for the most part, I mean, when you work alongside of people, you get to know your coworkers, right? So when you start to see people are withdrawing, social withdrawal, maybe some isolation, they're irritable, they're feeling sad or depressed. I mean, it's important to reach out, and I mean, that can be done confidentially. That can be a one-on-one conversation that you just have with your coworker or friend, and just say, listen, I'm noticing that, you're looking this way to me lately. And is there anything going on? Is there anything that I can do to help you? And do you want to talk about it? Right. Just opening that conversation up and doing it privately, I think is the best way to start that.
With many family members in the healthcare field, I'm wondering if any health authorities have implemented proactive programs since during the pandemic to prevent people from being from burnout or having overload in terms of mentally and emotionally being just overwhelmed, I guess is the best way to. Do you have any thoughts on that?
Yes, so the BC government website, they offer a page for workplaces. It's called Workplace Mental Health Supports. And if you go on there and click on the link, they offer online chat support. They offer mental health support for healthcare workers, first responders. This includes people working in manufacturing businesses as well. So this is for everybody. There's also a link on that government website, and it's called Workplace Mental Health Hub. And so if you click on there, this is a really great resource for employers as well. It offers free workshops and information to help employees in the industries that have been hit hard by the pandemic. And they highlight topics like managing stress and building resiliency. They can offer also counseling and peer support. So those are some really great resources to access.
Thank you, Andrea, and very, very valuable. Much appreciated everything that you've shared with us today, the resources, the tools, and to all of you for your questions. Thank you very much. Once again, those resources will be distributed to all of you following this session in a prepared recorded version of this particular session today. So a powerful experience for all of us, and a reminder as well for us to remain vigilant to our COVID-19 safety plans and get vaccinated when it's our turn to reduce this incredible burden on our frontline healthcare workers and move us all forward from this pandemic. Our second speaker today will be sharing the traumatic impact of a workplace accident and the mental and physical challenges a family endures through a life-altering experience. I'd like to, and it's my pleasure to welcome Maureen Shaw, and thank you for joining us today on this important National Day of Mourning.
And something we all need to remember, all of us who have been working in health and safety tend to, be putting our whole energy in ensuring that others are safe, but we need to ensure that those that we love and ourselves are safe every day and healthy in what we're doing. So I'm going to share with you that in spite of all my dedication and my passion for ensuring healthy and safe workplaces and that no worker is injured or killed or made ill as the process of their work, I and my family experienced a very traumatic workplace incident. My son, Mark, my daughter, Christy, and my husband, Norm, were impacted in ways that we never ever thought we would be. I'm going to share the story of Mark, and this incident that I'm sharing with you goes back quite a number of years, but it is still as powerful. It is still as emotional today as it was back then. So I'm going to share, and we're going to be a few slides that we're going to share with you, and I'm going to tell you the story of Mark, who was this wonderful, loving young man who loved to climb the Rocky Mountains. We lived just west of Calgary in a little village called Bragg Creek, between Banff and Calgary. And he spent all his time as a kid hiking, climbing mountains, fishing in a swimming hole. And you can see from this picture, absolutely proud every time he managed to hook one and bring it home, and Mom would help him and teach him how to cook it. So fast forward to Mark was, I guess, about, he would have been like 21, something like that. He had left high school. Mark was a guy who was always loving and bright, never quite managed to do well in a couple of subjects at school. He was someone with some specific learning disabilities. And he left school and he was going to go and find his way. And you have to let your kids, go. You have to let them do what they feel, what is right for them. And sometimes that is just leaving home and going and doing something that you have passion for. And for Mark, it was always being out in the wilderness, climbing mountains. So he got a job working in seismic, and he was doing heli-portable seismic exploration on the eastern Rockies in Alberta, and in British Columbia, and the western Rockies of Alberta. He was working up around Fort Nelson in northern British Columbia. They were doing heli-portable work. Mark was a shooter. That means that he laid the lines for the seismic explosions to take place. The weather it was in November, the weather was miserable. They had freezing and thawing and freezing and thawing. And the shot, which should have been 12 meters below the surface from, according to all good health and safety regulations, floated to the top. And you can see in this slide that it was a very muskeggy area, and there was a lot of snow and a lot of ice, and it had thawed, and the shot floated to the top. It exploded and left Mark in the middle, and it was like stepping on the landmine. Mark went up, down on his head, up, down on his legs, like an accordion, up, down, and the crater that was left after all of that was 12 meters by 9 meters. You can see a hard hat and some boots and so on, and that's Mark's. Mark was medevaced, helicoptered out of there, a very difficult thing. That itself was horrendous, taken to Fort Nelson Hospital, where he was transferred by medevac to University Hospital in Edmonton. I was working in my office at that time. I was working in my office in Calgary, and got the phone call to say that Mark had been critically injured and was being medevaced to Edmonton. I said to them, once you're in the air, it's only going to take an extra 10 minutes to get him to Calgary, which is where we were. And he said, no, it's way too critical. We've got a surgical team standing by in Edmonton, and well, they're waiting for Mark. So we, my husband, we got our bag, a quick overnight bag together, and off we went to Edmonton. We flew into downtown Edmonton. In those days, those of you who know Edmonton would know there was the planes between Calgary and Edmonton landed at the municipal airport, which is in the center of the city. And as we were flying in, the captain came on and said, we're going to have to delay our landing. We're going to have to circle because we have a medical emergency coming in. And as the plane tilted, I looked out the window. I looked out the window, and the plane was coming in and landing, this Learjet, with my son on board. We saw the ambulance backed up, and Mark was the one that was coming out and being taken to University Hospital. Our friend drove us straight to the hospital. We got there, and I didn't recognize Mark. His head was swollen. He was in pretty critical condition. He was not capable of making any decisions because of the pain medications and sedatives that he was on. And when I saw the x-rays, I knew we were in for a very, very long haul. Mark spent 4 months in University Hospital in Edmonton, and the picture you're seeing now is with his sister Christy, who was going to university here in Victoria and flew into Edmonton. And typical mother that I am, we can solve everything with a bit of food. So it was Christmas Day, and we ensured he had a little Christmas tree, and we brought food in. And of course, poor Mark, he's trying to smile there, but there was no food that would be able to stay with him. He, the next day, had surgery and ended up spending several days in the burn ICU unit because he had skin grafts. They attempted to save his legs by grafting, doing a lot of grafting on them, and also they transplanted the artery out of his arm into his leg to try to get blood flowing again. I think you can go to the next slide, Anna, if you like. And the next slide shows my husband trying to be fun. Mark would rather be having a beer or a glass of wine rather than this other stuff that's flowing into your body. After all those months, Mark was transferred to Calgary. Next slide, Anna. And the nurses just gave him a wonderful send off. And I love this quote from one of the nurses. It said, "Mark's wish, if all the world were a trampoline, life would be much less complicated." And this is a diagram of what happened to Mark. So he was transferred to Calgary. He spent three more months there full time, and then was discharged and back and forth for 2 years, having surgery after surgery after surgery. The impact on all of us was, and still is, incredibly traumatic. No mother wants to see a child going through what Mark went through and did for a very, very, very long time. So the physical impact on us was huge. The social impact was huge on him. The mental impact, the concern about addictions to the narcotics that he was on to control, to help manage the pain. And it's indescribable, the impact on the entire family. He spent many years then rebuilding his life. He, after a couple of years, he was going to college in Calgary to rebuild his life. He needed to go back to school, which he did with great success, I have to tell you. I am so proud of him. He, the kid who never passed a math exam, flourished and graduated from Southern Alberta Institute of Technology with an avionics degree. I was working in Toronto, and Mark had to manage a whole lot of things all by himself, including doing the presentations to try and get support for him to go back and continue his education and to be retrained, because he wasn't going to be able to do that mountain work again. And so being a long way away was really difficult. The day that another day that I'll never forget was the day that my phone rang in my office, and my executive assistant said, Mark's doctor is on the phone, and he was calling me to say, we need to amputate. The infections have just gotten too bad. We can't do any more surgeries. We need to amputate. And Mark, we want him to be able to make this decision, but he's in pretty bad shape. And I said, you have to do what you have to do. And so then I phoned a friend in Calgary and said, I can't be there. I'm going to get a plane out as soon as I can, but I can't be there. And would you go to the hospital and just be there when Mark wakes up? She did, and she put him on a cell phone, and so I could speak to him. And this strong young man just said, "Mommy, they took my legs. It still hurts after all this time, and I'm sorry, but it does still hurt after all this time. But I'm so proud of him." Mark became a survivor, where many people would have just stayed in the wheelchair. Mark became a survivor. He learned to walk on his leg. He graduated from college, and he took up one of the passions that he had even as a young boy, and that is sailing. He moved from Calgary out to Victoria and became a sailor, and became a member of Canada's Paralympic team. And one of the proudest moments of my life, oh my goodness, I'm sorry, I didn't realize I would do this. One of the proudest moments of my life was being in Beijing and seeing Mark and his fiancée then, Canetta. We were so proud of him. Here we are at the Great Wall. But the emotion when we saw him walk across the stage at the Paralympic sailing thing, carrying the Canadian flag on behalf of all of his teammates in Canada, was something we'll never, ever, ever forget. And so please just remember this on this National Day of Mourning. All of us are vulnerable. We all have to be completely committed to ensuring that we are creating workplaces that are safe and healthy places for all people. that we're acknowledging that it's the leadership in the workplaces that really have to come forward and to commit their organizations to being the safest and healthiest that they can be, to ensure that everybody gets to go home in the same way that they came to work. It's every day in Canada, on average, there are 3 people who die, who went to work in the morning and didn't come home to their family, to their friends, to their community. And I'm going to share with you that this is talk about a global pandemic. The ILO tells us that 2.8 million workers die every year. And I want you to remember something, the numbers that Lisa quoted and the numbers that I'm quoting to you as data that has been accepted. So workers' compensation boards across this country, the numbers that we have are those claims that are accepted. When we look at the numbers of injuries, that 300,000, it is probably 5 or 6 times higher than that. And around the world, 3.7 million reported injuries take place. So please, in this day, I would like to ask you to not just remember, but to recommit, to ensure that all of us who are health and safety professionals are doing everything that we can, that the leaders in our communities and in our workplaces are doing everything possible to ensure that our community, our workplaces, and our people are safe. Thank you very much.
Thank you, Maureen, and I really appreciate your.
I'm sorry, Lisa.
Oh, no, don't be sorry. Thank you for sharing. It's very powerful, for all of us here to hear, and I really do appreciate it. I know it takes courage, and it's not easy. It's still not easy, and it's life altering, and this is the impact. It's not a number. It's a family. It's people. Like it's part of our lives. It shapes our future, and
it does indeed.
And what you haven't shared, and I'd like to get a glimpse. You've made an extraordinary contribution to health and safety. Would like to ask you, how did this shape your future for trying to make a difference in health and safety, and how did this experience contribute to that as what you have accomplished over the many years in contributing to health and safety? Just hearing from you.
It does, Lisa. I mean, it did, and it continues to do. People was sharing with some of your staff yesterday as we were chatting that people frequently say to me, Maureen, you're now in your 70s. What are you doing? Still doing this stuff? The passion never goes, and we know how much more work there is that needs to be done. I keep looking at these numbers, and I've been quoting some of these same numbers for a number of years. And I mean, I was passionate before. I became even more passionate. The thing is that, I saw that Scott McKay from Threads of Life is online. I just saw a comment from him, and Scott will tell you, because we worked together for numbers of years at IPA. The passion only gets stronger because the needs get stronger. The workplaces are changing. New hazards, new risks are coming in each and every day. So we're never, ever going to be done. And I think for some of us, now it's our turn to try and help, to mentor, to encourage and support the people that are on the ground today in workplaces and in organizations like Threads of Life that are there to support people who are survivors.
Absolutely. Lots of work that continues to unfold for all of us, and really inviting those who are here today to invite questions of you for Maureen while she's here. I mean, all wonderful comments to you, Maureen. Thank you for sharing. Maybe talk a little bit about the Threads of Life.
I'm pleased to Threads of Life, and I think Shirley Hickman is probably going to be on today as well. I haven't looked, but I think she probably is. Shirley is the executive director of Threads of Life, and she herself is a mother who was incredibly impacted by the sudden death of her son. And I met Shirley shortly after that, and Shirley knew that she didn't know she was ever going to be the executive director and create an organization that's now a national organization serving about 3,000 families a year. But Shirley came to me and she said, I don't know how to do this. I mean, she would tell you this herself. I need some help. And I was fortunate enough that I was the CEO of an organization that we had over 200 employees, and we had every skill that was needed. I said, we'll help you with the business side of it. You know, we have the accountants, we have all of the stuff. We will help you. And so we became partners, and we founded the Threads of Life. And I wish you could see it, but on my wall there behind me somewhere in those pictures, there's a picture of the very first gathering of families from across Canada. These were mostly mothers who, isn't it funny? It is often mothers that really take those first steps. And Threads of Life has grown, and as I say, it's being emulated in other countries as well. And Threads of Life is there to support families and you know, all families, and also to support those that are survivors of workplace tragedies who suffered life-altering injuries. They host family forums across the country, and unfortunately with COVID, they're all being held virtually, but and they have counselors, they have people that have been trained to be, you know, who have also had incidents happen to them, tragedies happen to them, and so they're essentially peer support, well trained they know immediately what you're going through, and so I'd really like to encourage, you know, the people that are on this webinar. If you're a health and safety professional, if you're an organization, that you really should know more about Threads of Life, because they are there to help. If you know somebody who is suffering because of the impact of a workplace tragedy, you know, connect them with Threads of Life. They're not always ready right away, but connect them with Threads of Life, and you can call them. I even have the phone number here. I wrote it down. It's 1-888-567-9490, and I think Anna's put it on for the end of this program. But the peer support, the people with lived experience are often best able to support you.
Thank you, Maureen. We'll indeed include the link, the website link and the number. All of that is a valuable part of our package. So thank you for sharing that. Very important organization for all of us, you know, to have access to and to be able to be familiar with. Like you mentioned, normally we do a walk in early May, but with this pandemic,
yes.
it's
Steps for Life.
Yes. So this year, I don't know if that's going to happen. Maybe it's
virtually. There is a virtual walk, and if you go on Threads of Life, I think it's www.threadsoflife.ca. You'll see Steps for Life there, and you'll be able to sponsor, be able to walk, virtually walk.
Virtual walk, like all of our other walks, have been done differently. So please contribute, though, in terms of participation, because it's all recognizing very important, you know, initiative that all of us should be aware of, and everything that we have here to support those that have suffered losses. Maureen, you also have contributed to mental health and helping us all move forward with a key strategy to help us shape tomorrow in this important area. Can you talk a little bit about your role and your contribution to the standard that was developed?
Oh, the national standard. Well,
Yeah.
first to say that, you know, when we first started talking about mental health in the workplace, it was not something, I mean, talk about being in the shadows and talk about the stigma that Andrea so well talked about was incredibly prevalent in all workplaces. I mean, we were expected to suck things up. And I have to say that there was just some couple of key trailblazers that I partnered with in Ontario, where we began to talk about creating healthy workplaces, ensuring that the workplace that was not contributing to the psychological and social injuries that people were now beginning to suffer from, and they always had, but now we're paying a lot of attention to it. The Mental Health Commission was created. I'm just trying to remember the exact date, and I can't, but it was created probably about 15 years ago now. I remember the 10th anniversary, and maybe it was 15 years ago. Mental Health Commission of Canada was created and funded by the federal government, the government of Canada. And I was asked if I would participate in a new form that they were developing, and it was focused on workplace health, workplace mental health, and of course I would do that. So there was a wonderful group of people. One of the people that numbers of people on this call would know would be Dr. Jody Samra, Marianne Baton, and a number of others were all part of that committee. And it was back in 2012, we had a big meeting. I'm looking at it up here, a big meeting in Vancouver, where we brought together about 30 people, leaders from across Canada, and debated for several days. And it was at that point that we decided that, yes, we needed to create a national standard for psychologically safe workplaces. The standard, for those of you who don't know about it, there's lots of good information online. And I could, please feel free to email me or whatever, and happy to provide you with whatever information. But the national standard it integrates into your health and safety management system, and ensuring that we're creating workplaces that are socially, psychologically, spiritually, physically healthy places for all people. The standard is free. It's a national standard. There you go, national standard. Jennifer has just put the link up there. Thank you very much, Jennifer. And we're happy to help you with whatever information you need, and coaching to how to implement the standard as part of your overall management system.
Thank you, Maureen, for that glimpse, and really important, as we've shared this morning, and Andrea also shared a very important part of our program. As you know, the mental health piece is a critical part of our health and safety program.
And I might say, Lisa, if I could, as Andrea has so well expressed, during COVID, where mental health issues are extremely high, and we're going to see, mark my words, we're going to see, as we're coming out of COVID, we're going to see this silent pandemic of mental health really surfacing. People have been stressed beyond their capacities, and all that working from home is, anyway, it's please pay good attention to yourself, your coworkers, and your family.
Thank you, Maureen. Absolutely. And I know our organization is building a strategy for our industry together with stakeholders, and Maureen is on that table of stakeholders to help us all develop the right tools, resources, and programs to support industry effectively to moving forward. I mean, we want to pivot and reset into the future, but really taking mental health with us and supporting industry in this very, very important area. So more to come, certainly, and excited for that.
So Lisa, just one thing I'd like to say is that one of the things that I think is extremely hopeful is that all of resurveys and researchers telling us that employers are really recognizing that this is an absolutely key area. And we know that from our work with the CEO charter here in British Columbia, that they're all seeing that this is, so now is the time that we can begin to really make a difference in our workplaces.
Absolutely. Reset and pivot to the future, just absolutely. So a question for you, Maureen. What is the most effective way to get safety buy-in with young workers? So a question really looking at scare
And this
them,
is,
yes, with consequences or ongoing education. What would you recommend? How do we reach this demographic?
well, I think there's a couple of ways. And, you know, like there were about 35,000 young workers who were injured in Canada last year. This is a really good time. Hopefully young workers are going to be able to get jobs this summer. They're going to be very excited. Here's what I think the first thing is we need to do. We need to do some education of our educators in our schools. We need to be talking about, so, you know, it's April, you got who's thinking about a summer job and what are we going to do? That means providing some resources for our schools. I know WorkSafe BC has been doing some of that, but I don't think it's enough, frankly. We had a good curriculum program in Ontario that could absolutely get picked up. The second thing I think is really important is educating our families, our parents. I mean, you know, you as a parent, Lisa, you have 2 teenagers. I know that. So I'm quite sure that if Garrett came to you and said, Mom, I've got this part-time job, you'd be sitting down at the kitchen table with your husband and your other son, and you'd be saying, okay, tell me about this job. What is it you're going to be doing? Do you understand that you have rights as an employee? You know, what are the hazards? What kind of training are you going to get? Asking all those very, very basic questions. So those are 2 very basic things that we can do. And yes, it's all about training. It's all about awareness. And it's all about helping them to understand that while they have a responsibility, they also have rights. And, you know, these young people, they want the job. They want to do well. They don't want it. They want to be recognized for doing well. And so employers need to be ensuring that training is there for them. It's a big, big question. Thank you, Jennifer, for that.
Well, we all have a role to play, Maureen, and
Definitely
parents,
do.
you know, the more we know about health and safety, all of us, even if you're not in health and safety, the more informed, asking our own teens, as Maureen says, I have two boys, the right questions to help support them through their first or second job, and giving them information. The more educated we are on that, the more we're able to support their success and safety into their first job and beyond. So thank you, Maureen.
You're welcome.
Any other questions that we have for Maureen? That's all. Well, you know, I really want to say what a tremendous opportunity to be on the front lines with you, Maureen, today. It really is my pleasure for sharing your story, and what an incredible journey both you, Mark, and family have traveled through to where you are today. Your contribution to health and safety enormous, you know, that continues today through your passion to make a difference, bringing more workers, more home to their families. Really an inspiration for us all. So thank you so much.
Thank you, Lisa, and your team for all that you're doing, and to all of those health and safety people that are online, that are out there doing it. Thank you very much.
So we're going to stop here. I'd like to take a moment to once again thank Andrea and Maureen for sharing their heartwarming stories and insights with us today. If you haven't already, please take a few minutes to visit the National Day of Mourning dedication wall. Leave a message of your own if you're remembering a colleague or family member today. Thank you all for joining us. Take care of yourselves and stay safe.